CNN. On Wednesday morning, unionized employees at Kaiser Permanente, one of the nation's largest non-profit healthcare providers, began walking off the job. More than 75,000 Kaiser workers plan to join picket lines, marking the largest health strike in U.S. history. The striking employees are represented by a coalition of 8 unions that make up 40 of Kaiser Permanente's total staff. The vast majority of striking workers are in the western part of the United States, including California, Colorado, Washington and Oregon. The unprecedented strike comes at a time when labor activity is increasing in the United States, with tens of thousands of workers across many industries picketing for better wages and benefits. However, in the wake of the epidemic, healthcare workers in particular are struggling for safer and more secure working environments. Who is on strike? Many healthcare workers, including nursing staff, dietary workers, receptionists, ophthalmologists and pharmacists, are preparing to join the picket lines. Negotiations between union and Kaiser Permanente continued into Wednesday, according to James Santos, field coordinator for the coalition of Kaiser unions in Virginia. But he said no agreement had yet been reached to avert strike. We're optimistic there's still time. The strike is temporary. However, according to information from the coalition's largest union, SEIU-UHW, this strike effort may be followed by a longer, stronger strike in November if an agreement is not reached between the coalition and Kaiser Permanente. What are workers fighting for? Striking employees say staff shortages are driving them to overwork and exhaustion. In a recent statement, Kaiser Permanente said it has agreed to accelerate hiring and aims to hire 10,000 new people in union-represented jobs by the end of 2023. The union coalition is demanding higher pay, a strategy Kaiser Permanente management has implemented to combat chronic staff shortages, protections against outsourcing and early notice when management calls remote workers back to in-person work. According to an update from SEIU-UHW, progress was made in negotiations before the strike began, but management and unions are still a long way off on raises for employees. According to an October 1 update from SEIU-UHW, Kaiser Permanente has offered location-based wage increases for each the 4 years of the new contract, up to a maximum 4. The coalition rejected this offer, saying that such a raise did not cover the cost of living. The coalition wants an overall raise of 6.5% in first 2 years of the employment contract, and 5.75% for next 2 years. Workers are really under pressure right now. SEIU-UHW spokeswoman Renee Saldana told CNN. They've had the worst global health crisis in a generation. And then they show up paying rent. They're worried about losing their home, living in their car. Kaiser Permanente said in its statement that it is a leader in wages. We lead total